I'd like to welcome Dr. Bernier and Tim. How do you say your last name, Tim? Zepelek? Zepelek to our panel discussion now. And I'm going to begin by going through some of the questions that have come through the Q&A, and then I have a few other questions to supplement that with. The first question comes from Anonymous, and it says, does this central sensitization story also explain patients with fibromyalgia? I think that's for you, Tim.
The answer to that is yes. The short answer is yes. It's the long answer is, I think if we go back to that slide that Dr. Stano showed, fibromyalgia is one of the most common diagnoses that we see, along with many other ones, that would fall under that category of central sensitization. So yes.
I think a follow-on to that is, how do you know pain caused by, also by Anonymous, how do you know pain caused by tissue damage versus pain due to central sensitization?
It's a really good question. That really comes down to a thorough history taking with both the physician, the therapist, the entire team. History taking, examination, imaging. It's not a straightforward answer, and it's really a case-by-case basis, but we're really looking at the breakdown of, what makes nociceptive pain different from central sensitization pain. And there are, specific kind of categorical breakdowns, right, that we're looking at and we're thinking about as we're seeing a patient and as we're processing information. Again, it was subjective, objective, the history, the imaging, everything to really look at, well, what's the presentation here? And it may not be just one or the other, and oftentimes it's not just one or the other, right? And that's what makes it tricky. There are a lot of contributing pain classifications that are going on with each patient. It's not just this or just that. So.
Very good. I think, Dr. Bernier, the next question is for you, and I have the same question. It starts off it's from somebody called, why do truck drivers have increased pressure sedentary? And the question is, what does clot evacuation include? Just incision and remove clot.
Yeah, can you hear me? Yes. Perfect. Sorry, I have to call in on my phone and unable to video in. So truck drivers absolutely have increased pressure. When I talk to patients about hemorrhoids and their sources, I really try to focus on the pressure and less on specifically constipation, because anything that causes that increased pressure can do it. So truck drivers, people who sit for prolonged periods of time, desk jobs, people that bring their iPhone into the toilet with them, anything like that can cause that increased pressure. And then as far as clot evacuation goes, in clinic, what I do is I have patients on their left side with their knees bent up towards their chest, and then I try to do a pretty extensive block of the area. I use lidocaine with epinephrine to try to help with some of the hemostasis, and then make an incision over the point that the clot seems to be most involved. If there's already an area of thinning, or if it's a little asymmetric, you can usually sort of tell where the main culprit is. And then I do just make a linear incision over that, typically radially oriented to the anal verge, but can be just whatever seems most appropriate. And then gently using a hemostat or any other kind of forceps to try to scoop out the clot as much as possible. I try to balance that with clot that appears to be really stuck. So I have sort of a range of experiences with clot evacuation. Sometimes it just pops out and it's very satisfying and they feel immediately better, and that's fantastic. And other times it's pretty fixed. And I think that can cause some difficulty with trauma if we try too hard to scrape things out and expose blood vessels that maybe are trying to not be exposed. So, but that's my general technique. And then super important to do the warm water soaks afterwards, both for discomfort, but also to help evacuate any residual clot.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.